Alzheimer's dementia is probably one of the most concerning diseases of our time. As a physician, nothing seems worse than losing your ability to think, relate to others, and essentially being trapped in your own body. Since we now realize that the day we diagnose a patient with Alzheimer's dementia in our office, the patient has already destroyed or damaged 80% of the brain cells involved. This is the main reason that no matter what kind of drug we would prescribe, we would really not be able to help our patients even in the smallest way. In fact, it was always hard for me to prescribe a drug that could possibly cost my patient $800 to $1,000 a month, knowing full well that the chances of being able to help this patient was probably next to zero. However, there was often so much pressure from the family to at least try something that they would usually walk out of my office with one of these prescriptions that had been approved by the FDA for a treatment for Alzheimer's disease. However, when I became more and more interested in nutritional and preventive medicine, one of the key aspects of my research revolved around what could my patients be doing now that would decrease their risk of developing diseases like Alzheimer's disease or Parkinson's disease, especially when the medical community and literature predicts that over 25% of the population will develop Alzheimer's dementia by the age of 75 and nearly 50% by the time they reach 80 years old. This is why I often share current studies that show us a clue or at least a piece of the puzzle that gives us a better understanding or insight into how we can better protect ourselves from ever developing this devastating disease. Well, Thomas Littlejohn and colleagues have published a fantastic piece of work in the August 6, 2014 Neurology Journal that sheds some light on this problem. They evaluated over 1,600 elderly ambulatory adults with no history of dementia, cardiovascular disease, or stroke by determining their blood vitamin D levels at baseline. Those patients with severely low levels of vitamin D blood levels between 10 and 20 nanograms per ml were associated with a significantly increased risk for all-cause dementia and Alzheimer's dementia. Now, there are many theories as to why vitamin D helps the brain. However, the leading theories are the fact that vitamin D may help reduce the amyloid plaques in the brain that are the key finding in Alzheimer's dementia. Certainly, vitamin D also helps with the integrity of the brain cells and vasculature that supply blood to the brain. I certainly recommend that everyone have their doctor check their vitamin D blood levels at their next wellness exam, preferably during the winter months. Most doctors are willing to do this when requested by their patients. However, it is important that you also get the actual results of this test and not just let your doctor or his nurse tell you that your blood vitamin D level is normal. As more and more research is being done on vitamin D, we are realizing that what is reported as normal, which is anything greater than 30 nanograms per ml, is still not adequate. I personally recommend that you want to have your vitamin D level somewhere between 40 and 60 nanograms per ml at a minimum. If you have a strong family history of dementia or Alzheimer's disease, you would want your vitamin D level somewhere between 60 and 80 nanograms per ml.